I'm Meena Gupta. I'm chairman of LEPRA Society. These two projects, the Jyoti project and the Samastha project, are to do with HIV/AIDS, and both were supported by the US government under their major funding for AIDS throughout the world. Both these projects have been extremely successful. They have done some innovative things which hopefully will be scaled up into other areas in Andhra Pradesh as well as in the rest of the country. One of the major things that has happened is to work together with the Society for Elimination of Rural Poverty, SERP, and by using the women's groups in SERP, awareness has been created about HIV/AIDS, and a large number of women have been reached. APSACS has also been supporting this project. We have the support of APSACS, of USAID, of CDC Atlanta, and of course we have worked with SERP, which is again government of Andhra Pradesh. These two projects are limited to Andhra Pradesh and to certain parts of Andhra Pradesh. The Samastha project is limited only to 5 coastal districts, and the Jyoti project was also a limited area in Andhra Pradesh. We are hoping that in due course it will cover the rest of Andhra Pradesh, and in due course also some other states in the country. You see, this is a care and support program, not merely to prevent AIDS from happening, but people who already have got AIDS, how they live with it, how they live with their partners, how to prevent their partners getting it, how to avoid stigma, how to prolong their life, how to ensure that they have a good life, not just live, but how to have a good life. So it's to do with care and support to people with AIDS, and then how the community can support that. Well, these projects are coming to an end, so the funding which has come into the projects are coming to an end, but we hope, because of the very positive things that have come out, positive learnings in this project, that we will get support from elsewhere and that this can be upscaled.
My name is Kathy Donani. I'm the U.S. Consul General here in Hyderabad. I'm really pleased to have been able to participate today in this seminar on the dissemination of results from two projects that were funded by the U.S. government, one through USAID and one through the Centers for Disease Control. Both were part of our President's Emergency Plan for AIDS relief, our efforts around the globe to help fight HIV/AIDS and improve the care, treatment and prevention of HIV/AIDS that are coming to a conclusion today with the work that LEPRA and other partners, including KHPT and the Telugu network of people with HIV/AIDS. We are very pleased with the work the partners have done. We've heard some great things today about positive results from these projects, and we think they really are having an impact on the lives of members of the community. I don't have a specific figure for the number of cases of HIV/AIDS in the U.S. It's an epidemic that's been around for, well, we've known about it for about 25 years. It's been around longer than that, and it's something that is a serious impact. In the U.S., it's in narrow communities. Here in India, too, in fact, the epidemic is somewhat similar in that it's targeted in specific groups. Thank you.
I'm Dr. Ranganatha Rao from LEPRA India. I'm the Chief Executive. We have been working with USAID supported two projects, Jyoti and Samastha. Jyoti is a project which is funded by CDC of USAID, and Samastha was funded through Karnataka Health Promotion Trust. Jyoti was mainly concentrating on strengthening the systems and mainstreaming the leprosy HIV program into the society. So we worked with the self-help groups. We covered 4,000 villages, and we met many women and educated them through our own trainers. We also trained self-help groups system which is available in the government, which is called Society for Elimination of Rural Poverty. This is a very sustainable model, because even we withdraw, there is some knowledge left in the Society of Elimination for Rural Poverty, and they still continue to support their own communities at villages. The other component of Jyoti was to improve counseling and testing skills, which helped in reaching many sex workers and targeted interventions. This is to improve access to information to many people, and also access to services to many people who are living with HIV and who have suspicion of having HIV, who are having high risk behavior. So we want to, at the demand side, we want to improve their knowledge and get the testing done. And at the supply side, we are strengthening the systems to reach testing centers to various locations. So that we could achieve in many villages and also in urban areas. Yeah, what we do is we train the women groups in the villages, and they refer patients for the centers. In urban areas where the centers are not accessible because of timing and also money, poverty, we developed mobile centers. They go to different hamlets and test the people there. That is the main objective of this system. Samastha project, on the other hand, improved the clinical skills of the people through community care centers, and also improved compassion in the community about the people. A model was developed, drop-in centers, which is formed by people with HIV and to support themselves, leverage funds from government and their children, to support their children for education and for livelihood. Yeah, government is very, very supportive. They gave us place to start our centers. They give medicines to all our patients free of charge, and they accept all our referrals, and they also accept our training modules When we train counselors, when we train doctors, they send their training doctors, and they also help us in improving our partnership relations also. We are about 450 people. 120 of our staff are people living with HIV, and 30 people are living with leprosy. So it's one of our aim to give jobs, because charity begins at home. If we start giving jobs, then others will accept it. But we can't identify because of confidentiality reasons. Yeah.